just out of the surgery room. Everything went to plan.
Going to be an update on Conor McGregor's surgery. What we know is that he has had a rod placed on the inside of his tibia, and his lower fibula has been plated with plates and screws to stabilize it. So what that means is within Conor McGregor's tibia, there is a titanium rod, or what we call an intramedullary nail, that is sitting on the inside that is stabilizing it. So that bone is no longer able to be displaced with the fracture because it's stabilized on the inside. And he also had plates and screws placed on the fibula bone on the outside. So what that means is his leg is now stable. It's very good news. Sometimes when we do these operations, we will only place the intramedullary rod and we do not need to do the plates and screws on the fibula. So what that tells us is maybe his lower ankle fracture on the fibula was a little bit more unstable. Think very recently, Chris Weidman had released his x-rays. He only required the tibial nail on the inside, and the doctors did not need to plate and screw that fibula. So that is one difference for Conor McGregor. Going forward, the good thing about this operation is if we are able to have a good operation where we stabilize and the bones are in a good place, the bones are usually immediately stable. So although healing time typically for injuries like this of the bone, for bone to heal, is around 6 weeks, even before that 6 weeks is up and the bone has biologically healed, this would be a stable construct where we typically allow patients, and Conor McGregor, for example, to start walking on his leg and not have any restrictions to walking, because remember, there's a titanium rod on the inside of his leg. So he gave us an update where he said he was going to be on crutches for the next 6 weeks or so. Although that is true, most likely, hopefully the surgeons have allowed him to start fully weight bearing on that leg so the recovery process can begin. Obviously, he's going to have a lot of physical therapy upcoming. A couple questions I've gotten as an orthopedic surgeon is, how much do these titanium rods weigh on the inside? Does the leg feel heavier? No, they do not. They're very light, actually. They're actually hollow. They're made out of titanium, and they're not very heavy. Other questions I've gotten is, would he ever be allowed to fully kick and have that full power in the future? And I would say absolutely yes, he would. We've had many high-level elite athletes come back to the professional levels in not only mixed martial arts, but NBA and NFL with injuries like this. And would his leg be more likely to be fractured in the future? Actually, if you think about it, his leg would be less likely to be fractured because, again, on the inside of that leg, would have a titanium rod filling up the canal of the inside of the bone. So the bones are hollow, so that titanium nail would be on the inside of the bone, forever stabilizing it. Another question is, do the titanium rods usually come out in the future? Typically not. Typically we leave them in because they don't usually cause a problem. And so the final question, and maybe the most important question, Conor McGregor's recovery time and future outlook. So he's had the successful surgery. The surgeons were happy. If the bone becomes stable and he's able to start walking on it immediately, hopefully we can rid the crutches by about 6 weeks. At that point, then we would start being able to advance his activities. By that point, he'll already have been exercise biking. But if we can get him to start walking and pivoting, we could start simple activity after the first 6 to 8 weeks. And I think long term, as long as there's no complications, no infections, no blood clots, anything unforeseen, I think it's very possible and likely we could see the Notorious back in the octagon under 12 months. From a physical standpoint, in terms of the leg healing and being able to do so, from the mental aspect, that may be another question if Conor McGregor does want to return. But I think from a physical standpoint, I would be anticipating him to be able to return without hopefully any ill effects within 1 year. So make sure you guys stay tuned. I'll try to get to all your questions and comments below. Make sure you guys check out the recent Conor McGregor video that I did discussing his actual injuries, and make sure you guys stay tuned for updates. If you guys like this content, please subscribe to the channel, and we'll see you guys here next time.